Health professionals at major hospitals in South Korea have begun submitting their resignations en masse on Monday in support of medical interns and residents who have been on strike for 5 weeks over the government's push to sharply increase medical school admissions. This situation has put most of the country's health facilities in the fragile condition, especially in rural areas. South Korea's ministry has warned that it will soon start suspending licenses of striking doctors, which could further deteriorate the situation. Let's have more details of that in this report.
Hospitals in South Korea remain in crisis, with 90% of the country's resident doctors remaining on strike and medical professors now threatening to resign en masse.
All new chemotherapy and radiation are being cancelled, as well as for some patients who were being treated. Some patients died the next day after going to a nursing hospital following their discharge from the general hospital.
Trainee doctors are opposed to the government's plan to allow the enrollment of an additional 2,000 medical students each year, a number intended to brace the country for its rapidly aging population, as well as fix the current shortage of doctors in emergency medicine and areas such as pediatrics, where clinics are always crowded. There's also a shortage in obstetrics in the city, and in rural areas, a dire shortage of doctors of all types.
The detailed number of the quota increase was decided after a comprehensive review based on demand, surveys and social discussions on current shortages and long-term supply estimates.
The Health Ministry says it will soon begin suspending the licenses of trainee doctors who remain on strike. So far, those doctors are remaining defiant, claiming the government's plan will lower the quality of education and result in higher medical costs. Patient groups are calling on the government to make some compromise, while heavily criticizing the medical professionals who've abandoned their posts.
It is true and undeniable that medical professionals have abandoned patients and abandoned the medical field. Any explanation now about why serious patients are neglected and why doctors' groups are using their power deserve criticism from patients and the public.
As pressure mounts from all sides, the government and doctors show no sign of backing down. An impasse literally putting lives on the line.